Well, honestly, you don't really have to have a lot just to
Okay.
maintain good skin. So you just have to choose what is best for you. So we have to remember the skin is a reflection of what's happening inside.
Good day, everyone. I'm Dr. Jing, and welcome back to MD in Focus, the show where we bring you valuable health tips and recommendations straight from our St. Luke's experts. Today, on this heartwarming episode dedicated to Mother's Day, we have a special treat for all incredible mothers out there. Joining us is the esteemed dermatologist, Dr. Cynthia Tan. Dr. Tan serves as the head of the Department of Dermatology at St. Luke's Medical Center in Quezon City, as well as the president of the Philippine Dermatological Society. She's here to provide us with expert skincare tips and guidance. Welcome to MD in Focus, Dr. Tan.
Thank you for having me here, Jing.
Being a mother isn't just another responsibility. It's like taking on an additional role or job and balancing this work, which can be very challenging. I know I'm a mother. And for all busy moms out there, Doc, what can you give in terms of how to take care of their skin? You know, we're all very busy. We have our work, or even if you're just at home, it's very hard to manage the household, right? So how can we help our moms in the audience?
Yeah, well, basically, everybody should really take care of our skin, whether you're a mom or not, you're not a mom, right? But
Yes,
of course, lalo sa mga mommies, we really have to take care of it, especially as we grow old. You know, it really shows when you're really so tired and everything.
It's inevitable naman, natatanda tayo,
Yeah,
Doc.
but
Kaya,
we can,
kahit ayaw natin.
but we
no?
can always retard it. We
Yes.
cannot stop aging, but we can always retard.
Gracefully
Mapapabagal
age.
natin yan. Yes.
Okay. How do we do that, Doc? How can we make our skin age less fast? So, parang slower. How to slower?
Yes, first of all, you have to know what type of skin you have.
Okay.
Okay, so meron kasi tayong oily skin, may dry
Alright.
skin, may combination. And that's where the regimen will follow.
Okay.
Now, when you speak of regimen, yung mga ginagamit, hindi naman kailangan yan marami.
Okay.
Oh, may mga basic ano ka lang dyan na steps. So, number 1, make sure that you have a good cleanser to clean your
Cleanse.
skin,
Okay.
right? So, kung oily ka, use a cleanser na can take out the oil. Right?
Alright.
May mga laman na salicylic, ganyan. If you're on the dry side, don't choose those types of cleansers. You have to use mga moisturizing type, right?
Okay.
O, pag combination, then you can use any of those. It depends na rin kung ang season will make you more oily or it will make you dry. Pag malamig, di ba?
So, season is important.
Season,
Doc.
oo. Our skin varies also with the season.
Alright.
Okay, so cleansers.
Cleansing.
Yeah. Another is, of course, kasama sa cleansing, sometimes you can add some mga substances like toners.
Alright.
No?
What does a toner do,
Well,
Doc?
basically, a toner is any alcohol-based substance.
Okay, so it has
So,
alcohol.
Mas kailangan siya ng mga oily skin.
I see, okay.
Secondly, you have to remember to have your sunscreens
Okay.
for protection.
Mhm.
Kasi we know naman na a part of aging is photoaging.
Okay.
So, dalawa yan, di ba? Isang
Apo.
age because of your chronologic age.
Okay.
And you age because of the sun.
I
So,
see.
yan ang mape-prevent ng sunscreen.
Alright.
So, any age, dapat nagsisimula talaga tayo ng sunscreen, especially if your activity is always under the sun.
Doc, there are rules ba on how thick you should put it? Or parang may nakikita ko na
Yeah, yung
ano
puno
kadami.
na. As long as you have completely, covered the
Covered.
face, okay na yon.
Basta makover
And of
lang.
course, you know the type of sunscreen that you're using.
Yes.
So, anong SPF? Usually naman, ang minimum na nire-require namin is 15.
15?
Yeah,
SPF
and that
15?
covers your UVB protection.
Okay.
Now, you also have to make sure na may UVA protection yan. And you
Okay.
can see it with the PA na nakalagay plus.
Okay.
So, yan ang coverage ng UVA. Some sunscreens have also what we call physical blocks. Diba?
Physical
Yan
blocks.
yung mga medyo pumuputi yung muka.
Okay.
But it's good because para kang may opaque na material
Nakapatong.
to help. Yes. So, usually a good sunscreen has all those substances and those qualities.
Okay. Because there are some which does not have yung parang wala kang pumuputi na ano, no?
Yes, oo. Kasi may mga patients din naman na ayaw nila ng ganun
Okay.
di ba? Nagmumukha silang kabuki.
So that's
Princess.
also, those kinds of sunscreens are also working naman.
Oh yeah.
As long as they have the SPF, at
Yes.
least 15.
At least you can gauge na SPF 15 pataas, then you are protected from UVB.
Okay. And then, Doc, reapplication of sunscreen?
Yes, normally if you sweat or you go under sa water, you have to reapply mga 2.5 hours to 3.5.
So for
Yeah.
continued protection, kailangan
Yes.
mag-protect. So that's cleanser, toning if the skin is oily.
Yes,
Sunscreen.
the sunscreen.
Okay.
And if you're on the dry side, you have to have your moisturizer.
Okay.
So the point there is not all faces need moisturizers.
Not
no?
all.
So if you're on the dry side, at any age, you can use moisturizer.
Okay.
Kasi may mga ibang na may edad na but their
They
skin is
don't
still oily. So you
Okay.
don't really have to use moisturizers.
I see, Doc. So moisturizing and hydration, are these similar?
Well, in a way,
Okay.
yes. But hydration is really more of the water content mo
Okay,
eh,
of the skin.
right? Moisturization is you're keeping the water and the oil
Okay.
on the area.
So-
So usually, if you have, let's say you washed your face, medyo damp pa siya, that's the best time to moisturize.
To put
You
the-
trap it
You
Yeah.
tap
using the
water.
moisturizer,
I
yes.
see. So a person can be both oily but have dry skin. Parang ganun.
You can have combination
Combination.
complexion kasi, no? Sometimes, yung oily mo is on the center of the face where you have more oil glands.
So doon ka lang magtotone if you want.
Pwede.
Okay.
Oh, tapos yung dry side,
Doon
wag
mo
mo
lang-
nang lagyan. Pwede
I see.
yun. Mm-mm.
Okay, so that's 4 already, no?
Mhm.
Na that a person might or will need cleanser, toner hindi lahat.
Hindi lahat. Then your
Sunscreen would be
sunscreen and
good.
your moisturizer.
Moisturizer,
Yes.
not also for everybody.
Yes.
Depending on your skin.
Skin type, yes.
All right.
Mm.
What about yung mga other procedures that
Well,
our moms or our
yes,
patients
especially
are
for moms, no. We were talking earlier, right? Sabi ko nga at 30 years old, you can consider starting your anti-aging regimens. So dito po mapasok yung mga available natin sa market na you can use. This is to retard aging.
Alright.
So
What
yung
are
mga
these,
fine
Doc?
lines, medyo maiwasan muna.
Okay. Ano po yung mga
Well, there are many products in the market. Basically, ang mga contents niyan either retinol family,
okay,
or
vitamin A,
glycolic acids. No, these are mga tested na to help, kumbaga, retard, mas slow down niya ang aging process.
And I believe, Doc, it's not suitable for everyone as well, and it might be different depending on
Yes.
how much they should put, how often.
Yes, and what we have to realize, we don't have the same type of skin. No? So, meron din sa ating ma-allergy. So, minsan may mga produkto na you're allergic and you can't continue using it. So, it's always a case-to-case basis. You have to find what's best for your skin.
Okay.
But basically, the basic products that you have to use to maintain a good skin.
Of course, they have to consult and have their skin checked kung may problems.
Yes,
like
and
for acne,
yeah.
iba naman yun, no?
Yes, and of course, as you know, as a member and president of PDS, we always advise our patients to consult board-certified dermatologists to help you assess your skin and give you the best products that you can use.
Okay, kasi we have to remember that in terms of skincare, hindi lang siya for beauty, no? Kasi the skin is the largest organ of the body. It actually covers all of our body parts. And not just for beauty, there are also a lot of skin conditions that may need treatment. So it's just not also acne. There are other conditions that may
yes,
need the
definitely.
attention of a dermatologist. It could also be even pathologic talaga, as much as, skin cancer is also a possibility.
Yes, especially now na, ang heat ng sun is really different na, no?
From before. That's
Yeah.
the ozone being
Yeah,
thinner.
so we really have to protect ourselves kasi in the long run, cumulative ang effect kasi ng effect ng sun, and you will see the effect when we age na eh.
Okay.
So you get precancerous lesions, mga
Precancerous
like actinic keratosis, no?
Okay.
That eventually can be cancer, skin cancer later.
So it's
So-
good to have somebody check on a lesion.
Yeah,
no?
it's really good, especially sa mga taong may family history
I see.
of skin cancers. It's really very good to have a regular check with your dermatologist.
Okay. So great advice so far, Doctora. What about for other skin concerns like pigmentation?
Oh yeah, maraming mga moms yan talaga ang main concern nila. Well, the first thing moms have to understand, no, our hormones also as women contribute to the appearance of pigmentation. So, but most of it is induced by the sun. So, with the combination of hormones, especially mga nagpipeels, and then sun exposure, that's the best combination to have pigment. Yung sinasabing melasma, right?
Alright.
So yan, kaya dyan pumapasok ang sunscreen, avoidance ng sun hanggat maaari. And you can always use the FDA approved na mga bleaching creams available in the market, usually prescribed by your dermatologists.
Are there any equipments that can be used on?
Yes, there are a lot of mga
lasers,
machines na,
machines?
We have mga pigment lasers available in St. Luke's or other hospitals. We have also like mga procedures like peels, chemical peels. You have mga ini-inject na ng mga substances now na as long as they're FDA approved.
Alright. So, yung pigmentation can also happen, Doc, di ba, when you're pregnant? A lot of people develop like darker necks.
That's part. Kasi hormonal nga siya, Jean. So, hindi mo maiiwasan. That's why you have to parang accept lang that that's part of the normal physiology pag pregnant ka. And then, usually, a laking part na nawawala in the end.
Okay. It can be...
Yeah, it fades naman.
Alright. And it can be helped fast by other means, na like yung what you said,
of
yung
course.
mga like sunscreens and possibly bleaching or the
and
lasers,
procedures.
Okay. So, Doc, more on dermatology, di ba hindi lang naman po skin yung specialty? Yes,
dermatology covers skin, hair, and nails, Jean.
Hair and nails, okay. So medyo pwede po yung mga nagkakaroon po ng hair loss in women?
We have alam mo, number one, no, after pregnancy, you usually expect hair loss after 3 to 6 months.
Okay.
And that's what we call telogen effluvium.
Alright.
That's parang it's a normal lang yun loss na expected. Usually you get back the hair. Okay? But there are other skin hair problems like pwedeng lahi, androgenetic, right?
Okay. Or
yung iba induced by mga gamot. Di ba may mga sakit din like lupus, you can lose your hair.
Yes. What about mga menopause, Doc? Can it
as we get older, our hair gets thinner and nalalagas talaga.
And we can do something about those, Doc?
Yes, actually marami na. So it can range from oral medications, topical, yung mga pinapahid. And now we have mga yung ini-inject na growth factors.
Growth factors,
yes. This has passed, these mga procedures, nag-pass na yan ng mga
FDA.
And evidence-based.
Tried and tested.
Yes, of course. But of course, the last would be hair transplant.
Okay. So there are ways to grow back our crowning glory, no? In case it thins. Kasi I also have heard of mga stress-induced hair loss. Madalas yung
that's part of telogen effluvium. But of course, you also have yung sinasabi nating alopecia areata.
Ayun, autoimmune naman po ito.
But it's usually caused by stress.
Okay.
So, but yun nga, may mga gamot naman at may mga, as long as you consult the proper person, the right dermatologist to help you.
So, it's not always just normal to lose hair, no? Pwede ka palang may medical condition. Hyperthyroidism can cause excess hair loss.
Definitely. There are so many, anemia, even anemia.
So, in medicine, it's really like the skin, the hair, the nails. You see a lot of potential problems if you are able to do a good physical examination. Kaya kailangan talagang, I refer a lot to derms, no? Kasi I usually ask for help sometimes.
So we have to remember the skin is a reflection of what's happening inside. So a lot of skin problems are connected with something internal. And that's very, very important to catch at an early stage.
Yes, Doc. It can vary from autoimmune diseases, even cancers, no? So it's not just a vanity thing. If you want to see your dermatologist, it's not just because nagmamaganda ka, di ba? Kasi yung ibang tao parang sinasabihan na derma ka naman ng derma, no? But sometimes it's important talaga to be diagnosed with what you have.
Dermatology naman as a whole encompasses both medical and cosmetic.
Yes.
So, and it concerns skin, hair, and nails. So, whether it's pampaganda lang ba yan or kasi may sakit ka, it's still part of dermatology.
It's part of women's health and actually men's health. It's part of everybody's health, no? The skin care, hair care, and nail care.
As you said nga, biggest organ kasi ang skin.
Yes.
So you can just imagine the whole gamut of diseases that can be covered by dermatology.
Doc Cynthia, what about scars or peklat and wrinkles, no? Yung mga tinatawag nating neurotoxin.
Yeah, actually when you talk of scars, Jing, ang daming klase yan.
Okay.
Well, it can be surgical scar, yung mga galing sa cesarean,
Okay.
right? Scars of mga nadapa ka,
Okay.
scars ng pimples, di ba?
Oh, yes. Oo.
Usually, marami ng procedures available to improve.
The scar.
You may not take them out 100%, but definitely you will get improvement
So
with
at least
procedures.
it's less obvious.
Yeah,
lighter.
to make it less obvious. So, kasi scars can also be yung pigmentation lang naman, di ba? Pag pigmentation, you can just use mga pang-alis lang ng kulay, peeling or bleaching. But when you talk of surgical scars, you have the whole, range of procedures that you can do, from lasers to scar revision, even striae, yung
Ayun, stretch marks. Nakakaroon tayo.
nai-improve na yan ng lasers. But what I always advise my patients, stretch marks are really destroyed elastic fibers. Parang rubber band yan na hinila mo beyond the elasticity point. It can never go back to its normal.
Okay.
But you can already improve stretch marks with procedures now.
At least it won't be as noticeable.
Yes,
Parang
yun
ganun.
naman ang aim mo.
Yes.
Less obvious.
Less obvious. And then
Wrinkles.
Wrinkles.
Yes, wrinkles. Well, it varies kasi wrinkles may vary from fine lines to, the obvious deep lines. So, marami na ring procedures, but you can start from topicals, no? Mga anti-agings that we mentioned earlier. Now, you have a lot of procedures now like the neurotoxins. Sometimes if it's really a deep na line, you can use fillers.
I see.
And now we have the new, biostimulators in the market.
Okay. Doc, may mga nagsasabi na they don't wanna do Botox yet because masasanay daw sila. What can you say about this?
Well, you do neurotoxins because you want to paralyze the muscle. Because it's the muscle movement that creates the line. So,
Yes.
I think you use it when you see that the lines are really getting evident. No? And I think the lines can be evident at any age as long as you use the muscle too much.
Okay.
So, hindi siya parang pangmatanda lang. Ngayon, mga young ones use it because they really see a lot of the lines
And
already.
they want to prevent it from
Yeah, kasi
deepening.
ngayon, meron ng prejuvenation eh.
Okay.
Dati kasi rejuvenation
Rejuvenation.
lang. So, may prejuvenation na.
Prejuvenation.
Yes. And I think there's nothing wrong doing that as long as it's not too much. Di ba?
And then the effect only lasts for a few months, right?
Neurotoxins, yes. Usually
And
it's around 4 to 6 months.
And then
Fillers, it can go as long as 1 to 2 years.
And then if you want to do it again, then it's just something you talk to your dermatologist with.
Yes, definitely. Have it done with somebody certified to do it.
Alright. Kasi mukha niyo yun. No? It's
Yeah.
really important. Isa lang ang mukha natin.
Yeah, and of course, you really have complications if it's done improperly.
Okay. What are the possible or
Nako,
what have you seen
well,
already,
at
Doc?
least with toxins, pwede lang sigurong mangiwi ang mukha,
Okay.
bumagsak ang mata.
Reversible naman din.
Yes, in 4 to 6
mga 4 to
months.
6 months kang hiwi.
Pero I got a patient na naduduling diplopia because siguro na-paralyze yung muscle papaloob. No? Ang worst is with the fillers, you can
Okay.
get vascular necrosis,
Okay.
yung mga talagang na-occlude ang vessel, pwede kang mabulag.
Oh.
Yeah, these are really serious complications.
Okay.
So,
That's why you really have to do it
Yes.
with somebody licensed and trained.
certified to do it.
Certified.
Yes.
Doctora, thank you for shedding light on a lot of our concerns. What about diet, Doc? Do you have any tips for our viewers regarding diet and
Yes,
skincare?
it's always, in everything. I don't think it's just in dermatology.
Yes.
Good diet is always one of the main elements of having healthy skin, healthy body.
Yes.
So good diet, of course, moderation of everything, right?
Okay.
You have your proteins, your carbs, your fat, and of course your vitamins and minerals. So sa skin, we always advise our patients to have yung mga food rich in vitamins A, C, E, and zinc.
Okay. ACE and zinc. Doc, what about a lot of these promoted supplements for the skin? Is there any truth to this?
Well, what's important is, you always take them with proper dosage and you always study muna yung laman. Kasi I don't really think there's really a cure-all medicine for everything, right? So even vitamins, there's always hypervitaminosis na pwedeng mangyari kung na-overdose. So I think we just have to take the proper dosage of each of the vitamin and minerals that we need. Yes, and consult your doctor.
Iba-iba talaga yung needs
Yeah.
natin. Doc Cynthia, what about those many-step skin regimens? Iba nauuso yung mga like 15-step regimens mo ba yun? What can you say about these?
Well, honestly, you don't really have to have a lot just to maintain good skin. Just have to have yung mga basic elements that you have to know, yung cleansing, protection from the sun, moisturization kung kailangan. And as I always say, we have different types of skin. So that means there's no decahon thing for everybody. So you just have to choose what is best for you, whether it's cheap, it's inexpensive, or it's expensive. You just use what is working on you.
So kung ano yung humiyang-hiyang.
Yes.
It doesn't have to be expensive.
Yeah, kung expensive, sorry.
Oo, sorry. Yun yung hiyang sa atin. Pero kung mura and hiyang.
Yes. So I think you just have to try it and know if it's not working.
Okay. Doctora, thank you for sharing your expertise with us and our audience. Is there any last words or any last tips you'd want to share with us?
Well, I guess with this, in this age of a lot of social media things, the best is to consult a board-certified dermatologist to help you for your skin needs.
Thank you again, Dr. Tan, and to all the mothers out there, remember to take care of yourselves inside and out. And this is Jing. Thank you for tuning in to MD in Focus. And remember, your health is your greatest wealth. Always consult your St. Luke's specialist for more reliable health information. Remember to click the follow button. Until next time, stay well and stay beautiful.